Hey everyone, Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it only makes sense to have the absolute best when it comes to your health. My goal is by you listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. I am now seeing patients and clients all over the world virtually, so make sure to book your free 15-minute phone call today to see how you can start achieving Mahan or great health. I also want to mention that if you are in a state where naturopathic medicine is not currently licensed and you've experienced any benefits from holistic, naturopathic, or functional medicine doctors, such as this podcast, please be sure to look out for call to actions. Especially in the state of Ohio, we're currently working on pushing emergency licensure so we can support our MD and DO colleagues in reducing the overwhelm of the healthcare system. NDs are trained comparably to conventional doctors to diagnose and triage according to presenting symptoms, refer to the appropriate level of care, and support patients during at-home symptom management. NDs practice patient-centered medicine and tailor personalized care plans. And in addition to all the public health recommendations, NDs employ a toolkit of treatment approaches that can be used to support the body's inherent immune capacity to prevent viral infections, address viral infections directly, ease symptoms in those infected, and support recovery during post-infection care. This will significantly increase access to care because licensed NDs can serve in states that have declared states of emergency and are calling for volunteer healthcare practitioners to prevent their healthcare systems from being overwhelmed. So this is really important because we can be the first line to screen the patients to see if hospitalization is actually necessary, and for those whose symptoms are not severe enough to be hospitalized in general. For those people, we can support them with our naturopathic toolkit, which has been shown to have a pharmacological effect on related viruses, so we can be supportive of your immune system. And really, naturopathic doctors are the only licensed healthcare providers trained in the science and clinical use of these agents. So we can really make strides and changes within our healthcare system by allowing more naturopathic doctors to have or practice to their full scope. So with all that said, please be sure to follow my social media pages for how you can support these endeavors. We will be putting out a CTA or a call to action most likely within the week. So just make sure to look out for that. All right, getting into today's episode. Today's episode, I had the opportunity to interview a mentor, an inspiration, and so graciously, so gratefully excited to call him my colleague now, Dr. Paul Anderson, and we are talking about COVID-19 and vitamin C with some additional tidbits on Nsaids and other sorts of immune support and what you can do to support your health right now. So I'm really excited about this. Dr. Anderson is a recognized educator and clinician in integrative and naturopathic medicine with a focus on complex infectious, chronic, and oncologic illness. In addition to 3 decades of clinical experience, he also was head of the interventional arm of the US-NIH funded human research trial using IV vitamin C and other therapies in cancer patients. He founded the Advanced Medical Therapies in Seattle, Washington, a clinic that focuses on the care of patients with cancer and chronic diseases. He is a co-author of the Hay House book, Outside the Box Cancer Therapies, with Dr. Mark Stangler, as well as a co-author with Jack Canfield in the anthology Success Breakthroughs, and the upcoming Lioncrest Publishing book, Cancer, Living Your Life While You Have It. He is a frequent CME speaker, so that's the continuing medical education speaker, and writer, and has extended his educational outreach through his continued education website, consult dranderson.com, and former positions include professor of pharmacology and clinical medicine at Bastyr University, which is my alma mater, and chief of IV services for Bastyr Oncology Research Center. Dr. Anderson is this amazing man who has done so much work in terms of integrative medicine, and he's such a pioneer, and we are all so grateful for him. I'm telling you right now, Dr. Anderson is most likely the reason your naturopathic doctor has passed their licensing exams, because he created so many videos for us to study from, and I think for I think I speak for all of us when I say we are so grateful for him and the work that he has done in supporting us in becoming naturopathic doctors ourselves. So I'm so grateful for him. And we all admire him so much because, like I said, he really is a true pioneer on the forefront of integrative medicine. He continues to work ardently every single day to push integrative medicine and help the progression of medicine in general. So I can't even stress how grateful I am. And I'm so excited that he agreed to do this interview with me. And with all that said, I am excited for you all to listen to this. I know there's a lot going on in the world right now, but just because most of us are quarantined does not mean that all of our health issues just disappear. So we still have a lot of our other health issues. And so it's important to reach out to a naturopathic doctor or functional medicine doctor like Dr. Anderson or myself to see what more support you can get. And because NDs really can give you that extra support. All right, let's move on to the show. Make sure to leave comments below on what you thought of the episode and reach out to Dr. Anderson or myself if you have any questions or comments. But that's all I got, and I hope you enjoy. Hello, Dr. Anderson. How are you doing today?
Doing great. How are you?
Doing well. So so glad to have you on the show because you are the one who's been doing all the research. So I'm really excited to have you, the man, tell us what exactly is going on. So first of all, I want to ask about how you got here. So what led to you being the one who's like translated the research and getting so involved in COVID? What was that? Can you tell us a little bit about that?
Well, if you had asked me 2 or 3 or 4 months ago, I would have said I have no idea what that this is going to happen. Um, so I think the most, probably the most direct route to answer the question is I started in medicine actually in 1976 in the what we'd call the allopathic side of it, in laboratory work, and then did some research and development and some other things in the world of medicine. And then a number of decades ago now decided to become a naturopathic doctor. And so through that course, in the beginning, there was very, very little research about anything, especially the type of things we do. And I started to see a lot of people who were both chronically ill with infections, but also with cancer. And so I started to do a lot of work with intravenous nutrients like IV vitamin C and other things like that. You fast forward a number of years to about 10 years ago now. There was a National Institute of Health in the United States, NIH trial that was started. And one of the partners was the university I was at, which was Bastyr University. And we were partnered with University of Washington and the Seattle Cancer Care Alliance for advanced cancer and integrative medicine. So the patients could avail themselves of integrative medicine. And we would follow them and see if you used integrative medical care in addition to whatever your normal care was, if you lived longer, had better quality of life, things of that nature. My part of that specifically was running the interventional part, which was like IV therapies, et cetera. So for those 5 years, I had pretty much only stage 4 cancer patients. And we didn't just do IV vitamin C, but we did that a lot. And we did a number of other things that were very, at the time, innovative and good and fun and all that. So my prior experience doing it clinically and then the 5 years doing the NIH trial, during that time, I had to do a lot of background research into safety, pharmacology of vitamin C, how it works in people when you put in lower doses versus higher doses. All of those things that are just for patient safety, you have to do in a trial. And then that sort of led to people calling on me saying, well, you've already looked into this with vitamin C. Why don't you, could you write about this? Or could you write about it with viral infections or whatever? So you fast forward a ways, and the trial is over. I'm still doing all these things. And so when it came out, there's sort of two steps in American medicine. And one thing I want to be clear about, Other countries are a little different than us in that they don't really separate nutritional medicine and other medicine. They're kind of, it's all in one big mix, right?
Mhm.
So I have collaborated with a lot of people in other countries, and they've been quite helpful, and they'll do these things right in the hospital. Here it's a little bit harder to do. But one of the first things that we did in the US in modern times, there were some studies around sepsis and vitamin C, because if you're septic and your organs are failing, you need every advantage you can get. And so those things were starting and then being sort of percolated through the regular medical system. Then coronavirus and then COVID-19 as the disease state comes around, and people are starting to say, well, in China they're starting to use IV vitamin C. Can you find out what they were doing? And then that led to an international society for orthomolecular medicine who use nutrients as medicine, which are largely medical doctors, but there's some of us in there too. They had me do their international update on IV vitamin C for Corona or COVID-19. And that included what the Chinese were doing, uh, some things we had done, and putting it all together. So that kind of started this um, avalanche of requests for answering questions, etc. And I think it's not so much that I, know anything special. It's just that I had already had all of the other work done and done, for patients and for the government and all that, as far as safety and pharmacology and all. And I'd done it a lot in clinical practice. So when this came around, it was kind of easy to say, okay, the Chinese are doing this. It's similar to what we did here in America. It's not similar in this way, and here's what they're seeing. So it sort of, that's the circuitous route that I got here, and it's been, nonstop interviews ever since. So
Yeah, definitely. I can only imagine. So when you say some of the things that we've done here as well, do you mean in your practice with COVID specifically, or with other conditions like cancer, or
yeah,
both?
so yeah, good question. So that's actually, when I say we, I was speaking of
Okay,
America
collective.
as the collective. But to be clear, in my practice, there were a lot of patients, of course, with cancer that we treated with intravenous vitamin C.
Mhm.
There have been a lot of patients who had viral illness that we have treated who did not have COVID.
Okay.
And there are people with similar respiratory epidemic level virus like H1N1 that in the past I had treated. So I had experience kind of in all those areas. And then the bigger we was US experience with vitamin C and sepsis, and a lot of the, not everything, but a lot of the reasons that you would crash in let's say an ICU with sepsis are similar to the reasons with, say, COVID in an ICU you would crash. So it was sort of taking that information and saying, this can probably inform what we do with COVID.
Okay.
So the we is both me personally, but also the American experience,
Okay.
and trying to overlap that with what the Chinese doctors are actively doing right now.
Mhm. And when you say that it has similar effects to sepsis, let's let's go into it a little bit more on how this virus actually works, and
Mhm.
what are the similarities, and how is it, how has it become such a pandemic?
Yeah, I think, excuse me, I've been talking too much all week. I think that one of the things that to kind of boil it down to, the virus. Let's take kind of let's fast forward to the worst case scenario, which is what everyone worries about, which is being hospitalized and maybe being on a ventilator. Okay, that's kind of the worst thing. And what the experts are telling us, and I'm on certain phone calls with expert panels, I get to hear what they're saying, and they're saying essentially, if you have the flu-like symptoms of fever and body aches and cough and things, you can stay home and weather that out if you can stay hydrated and keep your electrolytes up and things. But if you get trouble breathing, you get dyspneic, you're having trouble moving air, that's when you have to go to the hospital because you need, some kind of help there.
Right.
So in the hospital, it's a very different set of criteria for both what can go good or bad. But that's actually the most critical time for people who have COVID-19 disease is if they have to go to the hospital, we want them to be there as short as possible and to leave everything on their own. Okay. So what happens with these respiratory entry viruses? So coronaviruses like to enter through the respiratory system, and they bind to receptors in there, and then they go in from there. So they create a literal chemical war inside your lungs. And your lungs, if people can imagine, and most of us in biology or somewhere learned about it, but they're very, very sensitive and tiny tissues because they move gases, oxygen and carbon dioxide back and forth. So they can't be big and thick like your skin or your liver or something like that. So they're very delicate. And to move oxygen in and carbon dioxide out, it happens naturally and very easily. But when you get an infection, like a pneumonia or something, which you can die of, when you inflame the lungs, they don't act right. And the biggest problem is instead of having just a little single cell layer where you can diffuse some oxygen in and carbon dioxide back, imagine if that layer, which has some immune cells and things around it, is all of a sudden swollen and your immune system is active, you get less and less ability to get air, oxygen, and CO2 in and out. So that's why people wind up either being in the ICU and trying to be stabilized or ICU with a ventilator trying to change the ventilation. So the most critical part about it is if you can avoid the hospital experience, you're more likely to live through the whole process. Now, what we don't know right now with data, because we don't have data from everywhere, et cetera, is how many people never needed to go to the hospital, right? In China, and we can talk about how I know this later, but in China with the hospitals that have dealt with the most COVID, um, their goal became keeping people out of the hospital and weathering it well at home. So they didn't do that. If you get to the hospital, the first thing that got everyone's attention, which is probably why I started to get the phone calls, was in China. They said, well, we've started studies to look at giving intravenous vitamin C to people in the hospital to keep them alive long enough so that we could get them healed up and out. And so vitamin C becomes very important in not just the hospital part, but in the hospital, if we're thinking like this little one-celled, transport membrane in the alveoli to get oxygen, carbon dioxide out, it's swollen, there's fluid there because of the immune activation. If we can do things to calm down the immune activation so that it's not so swollen and you get your air movement, et cetera, you're more likely to live through the hospital experience and come out the other side of it. The reason it relates to sepsis, which is it's a problem where you have systemic infection, but then it's not so much the infection, it's the chemical war that goes on all over in your body when you're septic with an infection. And that's what you die from, is the chemical war that goes on. In the trials, either with vitamin C or vitamin C and some other medications, what they tended to see was people stayed more stable and were able to make it through the hospital experience. So then the Chinese doctors who were doing that said, well, that's very similar to what's going on with COVID. Let's try it. And that's how they got there and how they tried what they tried. And we now have a handful of hospitals in the US who have also adopted some of these things as well.
Right. And actually, would you mind clarifying what, because in China, what they were doing was in the hospitals, right? When they were doing the intravenous vitamin C,
Yeah.
they were doing a much higher dose. And I think if I'm correctly remembering, the research on a lot of the sepsis research with vitamin C was very low dose, or what naturopathic doctors would generally consider low dose of like about 200 milligrams of vitamin C only. Is that correct?
Well, yeah, and that's actually an area that even a lot of the American doctors have gotten confused, and there's very logical confusion. So we should probably talk about that.
Yeah, let's talk about that.
Let's go there.
Yes.
What made me laugh? Well, it's I've been answering this question a lot because it is confusing. The way it was reported in North America was um, high dose IV vitamin C infusions are being used and trialed in China with people with active hospitalized COVID-19. The term high dose vitamin C in the research setting has two totally different meanings. And to most doctors who give IV vitamin C, it means the second version of its meaning, which is makes it even more confusing. So outpatient IV vitamin C, if someone says they're going to do high dose IV vitamin C as an outpatient, that is normally a shorter infusion of more vitamin C. And you're talking about 25 or 50 or 75 or more grams of vitamin C in a few hours, right? So so 25,000 milligrams is a gram. That's a lot of vitamin C over the course of an hour or two, or maybe 75,000 milligrams, right? So 75 grams. So that's classic kind of outpatient high dose. When they made these reports about, well, the hospitals are using high dose vitamin C, people thought, oh, they're doing that in the hospital. They're actually not doing that. Okay. The sepsis research, and this is another thing that it's a little different depending on who did the research, but here's the most important thing if you're in a hospital, okay? And hopefully no one we talk to will need to go to a hospital. But if you are in a hospital and you have either septic shock or you have COVID problems, what you need more than an actual high dose is you need a continuous dose of that adds up over time to a larger dose of vitamin C. So whether it's sepsis or COVID-19, as opposed to giving you a 2 or 3 hour infusion with a big ton of vitamin C that your body deals with for a couple days, we're going to have, you're in the hospital, you're not going anywhere. We're going to have a continuous infusion going. So every hour you get a certain amount of vitamin C and it never stops. Yeah.
Yeah. Just keeps it more
so
stable.
it's high dose from the point of view of you would never eat this much, but it's actually not that high of a dose at any one time. So then people, and this is the other conversation I get in with North American doctors, especially if they do outpatient medicine, they're not used to like the hospital end of it. They'll say, well, I give 50,000 milligrams, 50 grams in 2 or 3 hours. How are you getting away with giving these lower doses? The reason is you're giving it continuously. Now, if you're in a hospital, why would continuous dosing be maybe better than a big bolus dose and letting it go down? The reason is that this war I was talking about with the alveoli and things swelling up and getting inflamed so you can't move oxygen and CO2, largely that is, we want the immune response, we don't want to over response. When the immune response starts, it's fine. That's why you have the dry cough and stuff like that with most of these illnesses. But when the immune response keeps going, what happens is you burn up your antioxidant reserve so that your balance of oxidation, antioxidation is out of balance. And the body and the immune system have to be able to correct for that. Like, you need inflammation to create immune response, but you have to then balance it so the inflammation doesn't kill you. When you get this sick with something like sepsis or COVID, et cetera, what happens is you're losing your substrates, your kind of fixings for antioxidant function. They keep going down because you've been sick a long time. Oxidation just goes out of control, and either you have organ function failure or you have, in this case, your lungs just keep getting more and more inflamed. So going back to a long continuous IV vitamin C, in sepsis, they chose it originally because what's the one nutrient we need to keep the redox, the oxidation, antioxidant stable that we don't make as people? It's vitamin C. We can make glutathione on our own if we have the right substrates, and that's very important there. And the other parts are fat soluble, and we have enough stored, right? Vitamin C, the sicker you get, the more it goes down because you usually aren't eating enough to, like make up for big illnesses. So the theory was, well, what if we just put an amount in that would be more than they would get in their diet every day, but enough to balance this little ship of oxidation and see if the organs stay more stable. So literally the doctors on the expert panel in Shanghai who are dealing with most of the COVID patients, some of them were doing this with sepsis and other bad hospital illnesses. And they said, looks like the same problem that people are dying from. We don't have time. Let's just try the same protocols over here. So they tried very similar protocols. So one thing that we need to be clear about, and if you look up like the things I did for the ISOM or the things I published for hospitals, those are specific to a patient who's 24/7 in the hospital, can't leave, right? And there's a benefit to giving them the IV vitamin C continuously 24 hours a day for at least a week, or in some cases there they just do it till they're out of the hospital. So if you're not in the hospital and you're getting them on the front end when they're an outpatient, you could probably do like a 25 gram, a big vitamin C, or a 50 if it's appropriate and their labs are okay, and they'd be fine with that and it'd be very helpful. Once you're laying in a bed and needing mechanical ventilation or not, what you need more then is something continuous that your body doesn't have to worry about.
Right. Just like a stable dose.
Right.
And so I do want to mention that I will put all of the resources that you mentioned, like all of the research, in the show notes also, so that everyone can take a look at that as well. So I appreciate that. And okay, so with that said, I feel like I think you did you always do a great job of explaining this in such simplified terms. This is how we all passed our boards. But but yeah, so I really appreciate that. So one thing that I do want to talk about, because recently I've been hearing a little bit more about this, and I think that this is important to mention too, are contraindications then for vitamin C. So if someone or a loved one of someone who happens to listen to this podcast ends up in the hospital and talks about this, what would be potential contraindications for this style of vitamin C?
So, and again, that goes a little bit to the dose strategy too.
Okay.
So we'll kind of do it in two different phases. If you're an outpatient, not in the hospital, and your doctor's going to give you a big dose, like we were just talking about, like 25 or 50 or 75 grams in a few hours, you have to check and make sure that their kidney function is good, that they don't have any blood cell abnormalities. Simple to test, by the way, very simple test. And then there's an enzyme called G6PD that you test to make sure they're not deficient in that, because the big high dose given in 2-3 hours pushes on a system that enzyme is required to help. And if you don't have the enzyme, some people genetically don't have it, you push too hard on it and it could create other problems. So for outpatient, we would always screen people for, kidney function and blood counts and things of that nature, and then this enzyme. For inpatient use, when you get to a low slow, but they're there 24/7 getting it, most of those concerns about the labs kind of go out the window, because you're giving them such a tiny amount but continuously, the body never has to deal with a big ton of it. So you think about it like I had a patient had to go, and they had gotten very ill and they were isolated, and we did a big IV vitamin C with them like in the first 12 hours where they were sick. So I was all dressed up in all the stuff and everything. And in that person, you're giving, we gave them 50 grams, so a lot of vitamin C. It went in, in a couple of hours, really helped them and helped keep them from going to the hospital. So that was the good side of it. But if we did that and we didn't know that their kidneys could handle it and they had all the right enzymes and everything, it could potentially be dangerous. Patient in the hospital, they're just getting over time a lot of vitamin C, but their body can handle every hour having a very tiny amount put in, and none of those things are an issue. So here's another thing that we've learned from the Chinese doctors in the hospital. People in the ICU, whether they're on ventilation or not, who are moderately or greatly ill, are getting a lot of other drugs and things at the same time. So one of the concerns the hospital people will ask me is, well, what about all the other drugs we have to give the people? the infusion of vitamin C going on low and slow through the whole thing is done while they're giving all the normal drugs that are given in the hospital, and even rescue drugs. There's no interactions with them, especially at that
Okay.
dose. So it's another selling point for kind of the low slow dosing, as opposed to boom giving you a whole bunch.
Right.
The other thing is, if you're hospitalized, and if I was going to calculate what you needed, et cetera, I would rather give you a 24/7 dose that added up to the big dose, as opposed to giving you a big dose and saying, well, let's see how your body handles that, because you're pretty weak when you get to the hospital. Yeah,
Definitely, definitely. And yeah, and that was a great clarification too, because knowing the drug nutrient
yeah,
interactions is really
yeah,
important too. And I think that again is something that a lot of conventional doctors are concerned about when it
right.
comes to these nutrients. But
Yeah.
when you're doing in that stable, like low dose throughout time, but which ends up
Hmm.
being a higher dose, doesn't have that negative impact.
Yeah. Yeah. It's, I mean, if you read in the, probably one of the links you'll share, there's the expert panel from China. There's a Chinese version if you read Mandarin, and then there's an English translation. And if you look through there, when they get to, and vitamin C occurs in only a few places, they're kind of critical places, but it occurs there, and it's in the list with all the other regular drugs the person would get when they were that ill, and they've had no problems with and it's largely probably because the dose looks low, but it's persistent, and so it's never, there's never a ton of any one thing going in them at a time. Yeah.
Do you by chance know of any other countries that have also incorporated this into their practices with
Um,
this condition?
I've talked to some physicians in South Korea,
Okay.
where it's definitely been done. There's a few European countries that I have some connection with. One or well, more than one or two places in hospitals in Mexico. And I'm sure there's other places around. I believe there's even a little bit in, say, Australia. Australia is interesting because they were sort of on the front leading edge with some of the unique drug combinations for COVID. But they're also fairly conservative medically when it comes to other new things. But I met some physicians from down there, and I believe both South Africa and Australia both are doing little bits of this too. So it's not just in China. And
Mhm.
as I was saying, there's, I think, 3 or 4 hospitals in New York State that just started doing it, because what they did basically is they took the sepsis protocol, said it can't hurt. We're running out of beds. Let's do it. There's some in the Midwest I've heard about now. There's one I'm in Seattle, where we reportedly have the first cases here in the U.S. And south of us, there's a hospital doing it, and we're working on some of the hospitals up here.
Okay.
Yeah, and a few others. So it's kind of spread just hospital to hospital. It's very safe. It doesn't have a downside really, and that was just published yesterday in the emergency medicine updates that are done for ER doctors. They had a section on IV vitamin C in the emergency room, and they basically said it appears it's going to be helpful. You're always careful what you write down in research, uh, but because there's really no downside to doing it, and it's so easy to do, you should consider doing it. It's really, that's a really
That's
forward-thinking thing for the emergency physicians in the U.S. to put out there. Yeah.
definitely, definitely. I mean, it, like you said, it's so safe that um, what really the worst that can happen is that it just doesn't work, right?
Right.
But
Yeah.
it does.
Yeah. Yeah. At
So
at those dose strategies and doing it continuously, it's like all of the concerns you have with whether enzyme deficiencies or other problems kind of go away, because you're not giving a big giant dose all at once. Yeah.
yeah, definitely.
Yeah.
Okay, so we talked a lot about the hospital use and the higher doses of vitamin C intravenously, but what about the listeners at home to proactively work on their health? Can they take vitamin C, and can you explain a little bit more about,
Yeah.
get into the bowel
Yeah.
tolerance and all that a little bit?
So that's a big question that comes up. And
Yeah.
another confusion that happens is, for instance, when they published yesterday the emergency medicine update guidelines, they did a beautiful job of putting it in one paragraph. I was amazed what they got in there to, for the ER doctors. But one thing that they said, which is true in the hospital, but maybe not true when you're in prevention phase, is they said, oral dosing doesn't get your levels to the level we need with the IVs. What they're talking about, you need to make an apples to apples comparison of oral dosing in a hospitalized patient probably will not get them to those levels. If you're not in the hospital yet, what the Chinese are finding and have promoted, because the Chinese are doing everything they can to keep people from, they don't want more people in the hospital, right? So they're
I don't
promoting
think we
really,
do either.
I don't know, really don't either, right? So they're in China, they're promoting two things. One is vitamin C orally, because it's very inexpensive and you can do it. And they're doing what one of my teachers and mentors, Robert Cathcart, published a paper in 1981 about, that we all kind of knew, instinctively, but thankfully Bob published it, and it was called the bowel tolerance method of dosing vitamin C. And what Cathcart and people before and after found was, when you are well, you don't really absorb a whole lot of vitamin C, right?
Mhm.
And that's what a lot of people remember from physiology. So, well, a human absorbs 200 to 500 milligrams a day max, right? So why would we give people more than that? Well, what we've found, and now there's actually more science to show it, when you're sick, the SVCT transporters in your gut and the GLUT transporters get more open to sucking vitamin C in. Because as humans, if we were other animals, we would just make more vitamin C, but we can't do that. So your body has this thing where when it's sick under certain circumstances, it opens transport up and tries to pull in as much vitamin C as it can get. What Cathcart found, and what I've found in the years since, is when people are getting sick, I tell them, just start to take a little more of your dose of vitamin C throughout the day. So you don't take a big bunch at once. That's not good.
Yeah.
And I usually tell people, look, you probably can remember breakfast, lunch, and dinner and bedtime. So that's 4 doses. Start with 500 or 1,000 milligrams with each one. If your bowels don't get loose, meaning diarrhea, then you next day go up a little bit more, another 500 milligrams a dose or something. What I found is people who are really ill, like influenza, things of that nature, they'll, in 4 doses through the day, be able to take 10 or 15 or 20 grams of vitamin C and no diarrhea at all. When you're getting better, what I tell people is the bowel tolerance will go down. So if you start having loose bowels, it means you're getting better, so start taking less. And this is basically what Dr. Cathcart published. Um, you always want to start on the low end and work up, but you can go up every day, right?
Mhm.
So that's a short version of what the Chinese are trying to promote to people in the communities, to say, look, you're probably all exposed. We would like you all to stay healthy. Powdered vitamin C is very cheap, and like I use just plain powdered ascorbic acid, and I put it in water and I drink it, 3 or 4 times a day. Very easy to do.
Mm.
um, and that actually works, and it doesn't really defy real science long term, but it defies what most doctors remember, which is we absorb 200 to 500 milligrams a day of vitamin C. That's the average healthy adult human. A sick human has a totally different absorbance scheme.
Mm.
And one of the things that I think I did, and I tried to do in the international update for doctors, was we started with a section on prevention and oral vitamin C and the research we have now, and then we did the IV stuff pre and post hospital, and in the hospital. And a couple things. One is research that was released literally 2 days before I did that update showed blood levels of vitamin C actually rising with higher doses than we thought before. So I was
Mm.
able to put that in there, thanks to
Great.
whoever did that research. I don't remember who it was now, but it was great. And also just our experience of knowing a sick people can take an awful lot. So
Right.
when you get people, because a long time ago when I was training, I had a piece of my training that was obviously there was the naturopathic medical training, and a piece of it was allopathic training that I did. And the doctors in the allopathic side would get really worked up about, well, you only absorb 200 or 250 milligrams of vitamin C. So, us called you people, shouldn't be giving more than that and all that. And it was like, well, I've seen people, seem to absorb more than that, but I would keep my mouth shut. It was just, that's what's ingrained in your mind, from medical school usually, but it's actually not true.
Yeah, definitely. And I think it's important to note that too, and that the fact that I think it's about 60% of Americans have some type of chronic disease now
Yeah.
as well. And
Yeah.
so so
Yeah.
that's a lot of Americans with chronic diseases. That's including
Yeah.
like the heart diseases, diabetes, autoimmune conditions, all of these things that really most people will probably actually be absorbing much more than 200 milligrams of
Yeah.
vitamin
Yeah. Yeah. I think, that's enough to keep you from dying. And that's about it. Yeah.
C. Yeah, exactly.
Yeah.
Yeah, that's great. Okay, so one of the other things that I wanted to talk to you, I'm going to pivot a little bit from vitamin C, unless there was something else that you wanted to add about vitamin C.
No, unless it comes
Okay.
up later, I'm good.
Okay, so one
Yeah.
of the other things that I wanted to ask you about, because there's been a lot of conversation around this and controversy around it, and so I wanted to ask you about what your thoughts were and what you've read in the research in terms of NSAID use
Hmm.
and with NSAID use right now and its risk with COVID
Hmm.
and whatnot. So
Hmm. Um, yeah, it's interesting because there's and it's hard to go 100 years backwards and compare, scientific literature and reports and things because they were done differently. But even back in the influenza pandemic of the 1918-ish time period, there were reports written up that people who took aspirin, which is the prototype NSAID, would, if they were sicker, they would die faster than people who didn't use aspirin. Okay, so but it was always like, well, those are some interesting case reports. We don't know how many people was on one side or the other or anything. It was an observation doctors made, right? Um, and there was some sort of, you could kind of look at it backwards, inference that people who were in hospitals that wouldn't use aspirin but used other stuff seemed to survive longer, et cetera. So it didn't surprise me when, was it a week and a half or 2 weeks ago, the thing about NSAIDs came out. So non-steroidal anti-inflammatories are A, hence the name, not steroids, and B, they're things that are aspirin or aspirin-like. They all work kind of in the same pathway. So you have aspirin, you have ibuprofen, you have naproxen, all of those things. Everything pretty much that's an over-the-counter pain reliever except for Tylenol is an NSAID. Now, why would that create a problem? Because it's like, well, I hurt, I want to take something to stop hurting. Okay, that's
mhm,
very logical.
right.
Uh, one of the problems, though, it kind of goes back to what I was saying about what vitamin C is trying to counteract, and that is this immune war that's going on. We don't want the immune war to stop, but we don't want it to go out of control and make our lungs swell up and all of that bad stuff. Well, one of the things that happens, whether it's aspirin or ibuprofen or any other NSAID, is it shuts off a pathway of inflammation that's mediated by certain cytokines, little triggers or keys that turn stuff on. And it does it very specifically, but it sort of imbalances your inflammatory response. And so many people may have, because this has been around a long time, this is a example that people may know about. Many people with asthma will get worse when they take non-steroidal NSAIDs. And the reason is kind of the same. It's because it shuts off one part of the inflammatory pathway, but not all the other ones. So your joint pain may feel better, your fever may go down, cuts off that part. All of the drivers of inflammation just go to other places. And so you have to be very careful about shutting down inflammation in different ways when the person's body is in this inflammatory war trying to kick out, an invader. You don't want nutritional deficiency to cause, only inflammation to go on. You don't want drug excess to cause, no inflammation or imbalance inflammation. You want balance. So what happens, they believe, is the people get to the point where their fever's going up and they're feeling very sick, and if you've ever had influenza, you know exactly what I'm talking about. You just feel horrible and you want to take something to feel better. And so at that point, that's the reason your fever is going up, et cetera, is the war of inflammatory immune activity is going on at a high rate. You take something that shuts down one pathway of inflammation, and your fever will go down, and you will feel better. But if all that inflammation is not balanced in some other way, you actually can get more respiratory problems from it. And so that's where the recommendation to avoid Nsaids, if you can, comes from, really. And it's not really a new one, but it's because of with COVID-19, it's a lot like, say, SARS or H1N1. It's so excessively inflammatory and your lungs don't tolerate it that we're seeing these, you know, faster, more major contraindications come up, because it's real obvious when people throw themselves into more trouble. So that's kind of where the NSAID thing comes from. So it's tricky because almost all of the world, but especially North American humans, they've been trained that when they don't feel good, they can take aspirin or ibuprofen or whatever. And so your brain, that's the first thing you think of. But the reason that and I think they've done a good job of this, the reason that the health officials have done such a good job promoting this is probably not a good idea to go be your first go-to, is because they've seen such negative effects, and they know that people would automatically think that would be a good thing to do. So what it comes from is you can think about it like you're going to have this much inflammation going in, and if you shut off one part, it augments the other parts of the inflammation. And and this is more of a hospital thing, but in the hospital, they also have to be careful with steroids, which inhibit more inflammation, but they have to not give too high of doses. They actually have to give lower dose steroids in order to keep people from crashing. So it's not just NSAIDs, but in the hospital, someone else is worrying about that.
Got it. Yeah. If in that situation, should someone go for acetaminophen, or what? Yeah.
Yeah.
What are your thoughts on that?
Yeah. So here's the thing with acetaminophen. So it's not an NSAID. Acetaminophen mostly, Tylenol. Acetaminophen mostly works in your brain to change your pain perception. And so whereas aspirin or ibuprofen or something like that literally works where the chemicals are creating the pain or the fever, et cetera. So they're very different in the way that they work. Upside is acetaminophen Tylenol is not an NSAID. Downside is that the way your liver processes it uses up a lot of glutathione, and glutathione is one of those antioxidant things we use for balance. So if you're a chronic acetaminophen user, your glutathione levels or activity may be lower than you believe them to be, and you wouldn't notice it if you're otherwise healthy. So while acetaminophen or Tylenol family, they're not a problem in the inflammatory imbalance end of things. And you have to just be, real with people, because people are often going to take something. Now we'll get to other things in a second, but what I tell people is if someone's holding a gun to your head and they give you Nsaid or Tylenol, you can pick Tylenol, but make sure that you're doing something to bring your glutathione levels up, because you're going to be taxing them.
Yeah.
So the biggest danger with Tylenol, unless you're allergic to it, or acetaminophen, is lowering glutathione, because you require a lot of glutathione and glutathione substrate to process the Tylenol in your liver, especially. So you want to really, if you're going to take Tylenol, you do things to keep your glutathione levels up. And honestly speaking, like, there's a lot of people where they're just not going to do other things, and at least pick the safer thing, but do something to keep your glutathione up. one of the supplements I recommend to my patients when they're doing all this anyway is N-acetylcysteine. Helps your lungs keep the secretions a little calmer, but it also builds up your glutathione levels because cysteine is part of glutathione. But then the other thing is, for clinics, doctors like you and I, there's a lot of other things you can do for pain so that you can avoid either of those choices. And at that point, what I usually tell people is, look, if you want to do nutritional therapies, or as we would do, maybe more whole body naturopathic therapies, et cetera, find a provider who is expert in that, who's trained in that. Because your family doctor is trained to do family doctor stuff, and your naturopathic physician or an integrative physician, they're trained to do these other things that we're talking about. And I did want to make a point because it's come out in the data from China, and it's talked about a lot, and I just want to make sure that we give it some props too. In China, I said there were two things they did to keep people out of the hospital. One was oral vitamin C. The other was traditional Chinese medicine. And they also talk in the expert panel, they talk about using TCM, traditional Chinese medicine, when people leave the hospital, keep them from coming back. So they're using it as prevention and recovery. And the things in common with traditional Chinese medicine and the way it's done in China, obviously that's what they have available the most, are very similar to naturopathic approaches, where you're stepping back and looking at everything going on with the person, as opposed to they have this symptom and we just do this one thing. It's more of a whole body type of a treatment. So what I've been telling people as I do things is, if you want to do TCM treatment, or you want to do Ayurvedic treatment, or you want to do say a North American naturopathic holistic approach, find a provider who does that, and they'll walk you through all of this stuff. Don't just go out and try and figure out Chinese medicine on your own, or naturopathy or something. It's a little hard to do.
Yes. And it's so much more individualized. So even
Yeah,
what you and I do is
yeah,
going to be different. Even
yeah,
if we're doing similar things to
right,
support our immune systems, it's still different.
yeah,
Like I am taking NAC, and so is my whole family.
yeah.
But but the
Mine too.
dosages can change, right? Like
Yeah,
I recommend
yeah,
different dosages based on
yeah,
a person's circumstance or
yeah,
whatever we're trying to do.
yeah,
So
yeah.
so yeah, it's really important to talk to an expert, and that is really cool that in China they have that traditional Chinese
Mm.
medicine, and yeah, in other countries too, like
Yeah,
India with
yeah,
Ayurvedic medicine, and
yeah.
Korea.
And they're really something else. Just because I have connection with doctors in different parts of the world. Something I've noticed that will not surprise you, but surprises others, is if people have a particular, let's say, indigenous type of therapies they do, whether it's Ayurveda or traditional Chinese medicine. There's also a traditional Korean medicine that's done. There's other traditional medicines. As long as the practitioner, you go to the practitioner in your country or wherever who does that, it doesn't matter almost what the therapy is, because it's a whole body type therapy. It works. It works for prevention. It works for recovery, whether it's Ayurvedic or Chinese or Korean or our type of medicine. It's just helpful. And it's because it's stepping back and looking. And for people who never encountered one of these, you might have you might have, say, fever and aches and a cough or something, but your therapy may be, you might get one type of therapy, and your neighbor may have the same looking symptoms but get a different type of that therapy. So that's where we're saying, find someone who's good at these things, whether it's your naturopathic doctor or TCM practitioner or whoever, depending where you live. Yeah.
Yeah, no, and that's really important to get that information streamlined. I feel like I'm always emphasizing that you need
Yeah.
to work with an
Yeah.
expert to get that streamlined, because there's so much information out there on the internet, and
Oh yeah.
some of it's good,
Yeah.
and but it may not be good for you, and so I
Right.
think it's really important
Yeah. Yeah.
to emphasize that.
Yeah.
Yeah,
Yeah.
and
It's
then
it it
yeah,
is. It's because there's always little things that happen that, you might just be different enough that that's not the best thing for you. So
right. Exactly. And especially if you are one of those people who has a chronic disease, right? There's
Hmm.
so much more that we
Yeah.
need to address,
Yeah.
and at large. And so yeah, I think that's definitely really important. Okay, and then the last thing well, before we end, I just wanted to mention that everything that we discuss right now does not take away from the fact that you should be social distancing yourself and washing
Right.
your hands and doing all of the things that the CDC recommends. We're not at
Right.
all promoting not doing any of
Yeah.
those things. We're totally
Yeah.
promoting that. We're just saying, in addition to that, there's more that you can do
Right.
for your
Right.
health
Right.
proactively. Yeah.
Definitely.
Yes. Okay. So I think I'm good with all my questions. Was there anything else that you would like to add before we close?
Um, I think a couple of things, and these are trends we're seeing, and we won't know any of the truth till we look backwards 5 years from now, probably, at everything that happened. But because there are so many people, it appears, and this comes from other countries as well as a little bit here, who are low or asymptomatic but are carrying the virus. One of the reasons that we're doing distancing and stuff is you may feel fine but be carrying it, and you may go see somebody who has other, heart disease or lung disease or whatever, and you sharing it with them is not a great idea. So there is a lot of it's different than a lot of other diseases where it's like, well, you'll feel really sick 100% of the time if you have it. With this, you can be a low or asymptomatic carrier, so you want to protect the others around you. The other side of that, though, is what we're looking at is there may be people indeed who have a very mild illness and don't really get that sick. There's a lot of people don't go to the hospital, thankfully, and weather it well, or they do a lot of other things. I've talked now to a handful of people who tested positive, had the symptoms, but did a lot of naturopathic integrated therapies. They didn't feel great for a few weeks, but they came through it, didn't need to go to the hospital, and they came out the other side. So the negative side of low symptoms is you could share with others, but the positive side is we'll probably find there's a good section of humanity that can weather it with these supports and not need to go to the hospital, and that's great because less
Right.
hospital is better unless you need it. Yeah.
Exactly. And so many hospitals are starting to get really overwhelmed
Yeah. Yeah.
now. And I
Yeah.
know a lot of units, like emergency units and everything, are just turning into COVID
Yeah.
units. So it's
Yeah.
crazy.
Yeah.
But
Totally.
yeah,
So that was my final wisdom for the evening
yes,
here.
I appreciate it. And
Yeah.
do you have any like resources or anything that you would like to share with the audience so that they can be more well informed when deciding what to do for their health? And of course, again, emphasizing again that you still need that individualized treatment, but just more
Yeah.
resources
Yeah.
for
Yeah. I
just
think
knowledge.
the there have been a number of uh, there have been a number of interviews I've done with different people that you can find probably everywhere now. um,
Yes.
there's a podcast I do called Medicine and Health. You can find it on all the pod burners or whatever you call podcast sources. It's on all of them now. But look for Medicine and Health with Dr. Paul Anderson. You'll see me in a suit, and that'll be me. The last four have been either directly about COVID or about immunity in general, and there's a lot of helpful hints in there. If you like celebrities, I did a interview with on the Gabby Reese podcast. She's much more famous than I am, so she's easier to find. Just a few weeks ago, and we went through quite extensively just what my family does. And again, it's not saying every family needs to do it, but it kind of gives you a picture of that. And then I think in the show notes you'll have some links to the my website and things where
Yeah,
people can find me.
definitely. I'll put all of that in there.
Yeah,
Yeah, and you can find you on all the social media channels as well.
yeah.
So we'll link all of that information. But thank you so much for coming on the show. I really, really loved having you, and I'm so grateful that you came on the show.
Thank you for having me. It's wonderful, and more good information is good for everybody. So thank you.
Yes, definitely. And hopefully I'll get to have you again when at a different time and we can
When
go
we don't have
into
an acute crisis going
yes,
on.
exactly. We can
I'd
go
love
into
that.
something else. Yeah,
Yeah. All right.
definitely. All right,
Thank you.
thanks. Bye. Hope you all enjoyed that episode and now have a better understanding of how vitamin C actually works and how the myth of if you take any more than 200 milligrams will just be excreted out is just not the full truth. So I hope that helped to clarify that and some other things that you may not have known. All right, I will have Dr. Anderson's information and the research we mentioned in the show notes below, so make sure to check that out. But that's all I got for you all today. Be sure to stay tuned for what call to actions we put out there to support our healthcare providers during this time. But for now, let's all do our part and physically distance ourselves from one another while staying connected wirelessly. Wishing you all Mahan health, and I will see you next time.